What are the options for treating double vision? Well, there's always the option of just living with it, which some people are able to do. And if you do leave it long enough, occasionally you can get used to it, maybe after 2 or 3 years. That's not very practical for most people. They want to get on with their lives free from double vision. The next option is Prism. What Prism does is it bends the light or deviates the light in your glasses, and that allows the images to be lined up. It does work pretty well for a range of horizontal angles, a smaller range of vertical angles, but it does not do well for large angles. So when the eyes are properly misaligned, the prism doesn't become a good solution. And the reason for that is it becomes very thick. When it's thick, it becomes heavy. It induces distortions. You get kind of surprise things popping into your vision. The overall quality of vision comes at quite a cost. The other thing that Prism doesn't do very well is when your angle of misalignment changes from, say, straight ahead to the side. Prism can't change in different directions of gaze, and therefore when you have what we call an incomitant squint or double vision, meaning it changes in different positions, Prism rarely is the option. The other thing about Prism is that it just keeps increasing. So you get used to a certain amount, and then you need a bit more, and then you need a bit more, and that's fine. But the cost of Prism glasses is quite a lot, sometimes 500 up to 1,000 even, and changing that every 6 to 12 months does become quite expensive. But Prism is an option for many people, especially with smaller angles, constant, the same in all directions, not changing much. Then you've got the issue of Botox. Botox is okay for some patients, people who can't have surgery or people who don't want surgery, don't want Prism, then you could use Botox. The problem with Botox is it only lasts for a few months, it wears off, you're back to where you started, you have to go through it again. Then we're really talking about surgery. For almost all cases of double vision, surgery is an option. I can't think of any cases where you couldn't consider a surgical option. Now, it may be that it can't solve the problem 100%, but it can certainly improve the range of single vision, or at least give someone a useful area of single vision, which we normally like to have straight ahead and slightly down, which covers most of the activities we need in daily life. Yes, if you've got double vision and you've been told that there's no option for surgery, then come and see us and we will tell you whether we agree.